Hi everyone, thank you for joining me for another session of Supervision Sundays. I'm Dr. Brittany. I just want to take this opportunity to thank you all for joining and checking in with all that is going on. I really hope that everyone is staying safe. Practice social distancing. That is not the same as isolating yourself, but it does allow you to protect you and your loved ones and the community from spreading COVID-19. This is lasting a lot longer than anticipated for some, and I know that it's impactful to you all's jobs, to your clients, to the general community. And so I just want to remind everyone how important it is to manage your mental health during this time, not just for those of you all who are clinicians, but anyone who's a first responder and in your personal lives. It's super important to manage your mental health. Today's topic is going to center around the psychological impact of pandemics. I think that it's important that we look at the data and look at the research and what it says about other pandemics and how that has impacted the general public as it relates to mental health. So let's jump right into it. I see a lot of clinicians having a lot of questions surrounding how this is going to impact their clients, how it is impacting them. A lot of clients are fixated on this topic. That's what they want to talk about in session, and rightfully so, right? It is impacting them on a day-to-day basis, impacting their families. It's severely limiting their ability to go out in the community and utilize different coping skills. So if you have clients who, prefer to do yoga, they're having a transition over to maybe virtual yoga as a different option. And so I think this is an important topic for us to look at, because there have been studies that have looked at the impact that pandemics have had on mental health and psychological well-being. And so you have to remember that with the H1N1, Ebola, swine flu, for those illnesses, individuals were first responders during that time, and individuals were quarantined or asked to isolate during that time. And so researchers have gone out and really looked at how that impacted their mental health. Important implications from this research for our practice, right? Because it allows us to kind of understand what we may see in our clients and even in ourselves as we continue to practice therapy ongoing. And so some of the things that came out about this research, and I'll be sure to share a few of the articles for those of you who are truly interested in this topic down in the comments so that you can look at the research yourself. But for the purpose of this, some of the interesting things that came out about it is that individuals studied had at least 3 years post-pandemic symptoms, and those symptoms mimicked post-traumatic stress disorder. So I think that's very important, right? And so when we think about that, individuals were showing symptoms of anxiety, fear, nervousness. A lot of people were experiencing symptoms of guilt, which I think is also important, because that's not just for individuals who actually contract the illness or the virus, but for individuals who were first responders and were able to go in and serve, but did not get sick, but maybe saw some of their peers getting sick or some of their loved ones getting sick. Other things that happen is that for individuals who quarantine, they were more likely to develop these symptoms and have lasting symptoms up to 3 years. So especially for children. For children in these studies, what they found is that children were 4 times more likely to score higher for post-traumatic stress when they were asked to quarantine. And that's super significant for those of you all who work with children. Now, there are some prerequisites that come with this, and so individuals who are already have pre-existing mental illnesses, they may be more likely to experience these symptoms, but that does not mean that they are guaranteed to experience these symptoms, right? Because some people may have a really good plan self-care wise, or really good coping skills or natural supports, are able to transition over to using virtual supports a lot easier. So don't just assume that because your client has pre-existing mental health that they're going to experience these symptoms at a higher rate, and don't assume that because someone does not have pre-existing mental illness that they may not start to display these symptoms. One of the things that also came up is that they found that women were more likely to develop these post-traumatic stress disorders over worry, especially women who had one child. However, the research did show that for women who had 3 children, they developed more of a protective factor around the illness, and so they didn't develop the same symptoms. So I think that's really interesting, and I'd love to see more research about why that may be. I have not looked into it, but I thought that was a very interesting piece of research. And so with that, we got to start thinking, okay, what can I do? If we know that our clients and even ourselves are going to be more prone to develop post-traumatic stress or symptoms that appear to be post-traumatic stress disorder, then we got to really look at what we can do to support each other during this time to reduce the likelihood that we develop those symptoms. And so that's where self-care comes in. What I love about social media right now is that people are getting really, really creative, and so I want to encourage you to encourage your clients to do these things. I'm seeing people do dinners over the FaceTime. I'm seeing virtual yoga. I'm seeing workout sessions. Someone's doing Spirit Week on Facebook, and those are really, really important. We're streaming church services, we're streaming all kinds of learning activities for children, and so it's very important that you do not isolate during this time. Isolation can be very dangerous for your mental health, but actually stay connected. And so it's not to say that you shouldn't take some time out to just be away from the world. Don't overwatch the news, but have some time built into your day where you're able to plug in and see what's going on with other people and have conversations with other people, especially if that means picking up the phone and having an old-fashioned, not text, but old-fashioned hour phone call. I had an hour session with my aunt and with my best friend, and we can go on and chat about things for hours, but that is very, very essential to me managing my mental health and self-care plan. And so I encourage you all to do that, but also to sit down with your clients, of course, via telehealth, and really outline what that's gonna look like for them during this period, because again, the social distancing guidelines have been extended to another 30 days. And we wanna just make sure that people have at least a 60-day plan, because we're not just planning as clinicians to help them during this time frame, but we're also doing aftercare, and we're doing a plan to help them ongoing. So those are my thoughts. That's what I wanted to share with you all. I'd love to keep the conversation going in the comments. If you're not already following the business page on Instagram, on Twitter, it's @LeadClinically. All videos are, of course, uploaded to YouTube. Please share with your friends. Give me questions if you have them. I'll do my best to answer them. And then again, thank you all so much for joining me for another session of Supervision Sundays.